There could be many causes for the aches or pains you're experiencing. One of those may be something you don't even realize you're doing to your body every day. Dr. Sean Riley from Tulsa Spine and Rehab joins us. Dr. Riley, tell us about compensation patterns and how they impact people.
Sure, Scott. One of the most common things that we typically see is like neck and low back pain. And so we'll examine a patient and determine what their problems are. And many times, we'll make a determination that their problem necessarily isn't in the neck or the low back. And so we try to screen, a person all throughout. We might spend quite a bit of time, for neck pain on their upper back, for instance. And what we're looking for with screening that upper back is we're looking for limitations related to mobility. Okay, so do they have flexibility issues? Are they tight? Or do they have some stability issues? Is there some weakness? Do they need to build up some strength? So what happens, the two most common compensation patterns that we typically see in the clinic here is it's going to be a tight mid-thoracic or mid-back. That's that area right between your shoulder blades, okay? And then also tightness or lack of mobility in the hips. And this is most commonly going to be associated with folks that sit for extended periods. I know we've spoken of this in the past, but when we sit for extended periods, those hips have a tendency to get really, really tight, okay? And then, we're hunched over a computer or on the telephone all day long. And so that mid-back, we might develop restrictions or limitations in those areas as well. So the mid-back and the hips are two areas that we want to attack typically for related to mobility. And then secondary to that, you start developing some compensatory patterns related to weakness, gluteal amnesia. We've spoken of that in the past. Mm-hmm. Sitting on your butt all day long, those glutes become a little weak. And so you'll get tight hip flexors maybe, okay, front of your hip, and then you'll get weakness in the glutes, the backside. And then the thoracic spine, you get tight there, upper traps. Everyone says I'm carrying my stress in my shoulders. And then they develop weakness in the cervical region or, the neck, those stabilizers, those muscles that their primary job is to stabilize or hold your head up. And so guy comes in with neck pain. One of the first things that I'm thinking of is, okay, I wonder how mobile or how flexible is he or she is between their shoulder blades, and we'll attack it in that direction.
So is this something that develops over a long period of time, so it's maybe hard to realize that it's happening?
Sure. We get away with it. We'll go weeks, months, years without hurting. And then all of a sudden we wake up one day and we've developed neck pain. And so I use the word or phrase cumulative trauma. It's obviously not nasty trauma, but over time, repetition, it's what we're doing on a day-to-day basis, whether it's driving a car or a truck all day long or sitting at a desk, these things start to catch up with us, and then we develop, weakness. And I talk to a lot of actually, my athletes. Compensation typically leads to injury, okay? And so those are some more serious things. We can, you can have so much lack of hip mobility and, glute weakness, and then what happens is we're going to compensate, okay? So if my hips are really tight and my mid-back's really tight, I'm going to pick the motion up somewhere. And typically I'm going to pick it up in your low back. And so we see a lot of shifting and, instability in the lumbar spine. So for instance, I saw a patient this morning with low back pain. He had seen a chiropractor in the past. And, I said, well, what did that chiropractor do? Well, he started adjusting my low back. Well, I think that's totally counterintuitive and counterproductive, because if we're moving too much in an area, why would I want to sit there and mobilize it and move it even more? I want to stabilize the lumbar spine. Okay. And then I want to get the hips and the mid-thoracic spine moving a little bit better.
So when you see some of these patterns develop, what are some treatment options?
Well, manipulation is a good one, or, mobilization or flexibility type exercises. So with hips and mid-back, we want to figure out how we can get it moving. Manual therapy related to soft tissue or joint, getting that moving. I think that's a really good kind of frontline treatment or defense of those type of issues for tightness. Then you have to empower the patient. Okay, these are 4 to 7 exercises related to mobility or stretching of your hips and thoracic spine that you can do on a day-to-day basis that will prevent these conditions from coming back in the future. And then most, obviously just as important is stabilizing some structure with physical therapy or exercises, core stability, trunk stability, home programs, those type of things.
So it's sort of a two-pronged approach. You have to address not only the results of these patterns, but really the causes of them.
Right. Take a look at, what the issue is, and then, figure out fundamentally what potentially might the true cause be. And I would say, 75% out of the time, 3/4 out of the time, it's not to the air, with the area related to directly to the of injury. It's going to be in some other, part of your body.
If you're experiencing pain, contact the professionals at Tulsa Spine and Rehab. They'll give you a thorough exam and customize a treatment plan that addresses your specific needs. Give them a call today at 918-743-3737.